Dr. Ejo, good to see you.
Good morning. How are you doing?
We are doing
Very
good, and
well.
we know
Kind of
you
looking really
are.
fresh. You're looking very nice today. Maybe
All
because
right.
the background also has some orange and then there's red and pink. It's very colorful.
You
Thank
know,
you.
we appreciate you when we look at you and how beautiful you are and how delightful you are always. And so we want to emulate that.
Oh well.
We're
Okay
just trying to
then.
be like you.
I did her now.
All right, you can take it over from here.
Thank you. Good morning, viewers. Welcome back to Kakaki Cancer Awareness. I am Dr. Ejo, your host today, and we will be looking ahead, not just at where cancer care in Nigeria is today, but where it's going. Our topic is the future of cancer treatment in Nigeria. Welcome once again to Kakaki Cancer Awareness with Dr. Denise Ejo. Together we fight, together we win. Dr. Amaka, as they've introduced, Dr. Wamaka Lashibikon is my guest. Dr. Amaka, good morning.
Good morning, Denise. Pleasure to be here as always. And I join the others to say that it's always a pleasure to see you looking lovely and also very inspiring with the work you're doing.
Thank you. You're looking very good this morning as well. Wow. Considering I know you're always traveling all around the world, but let's get on with it. So now, cancer is one of the fastest growing health challenges in Nigeria, with thousands of new cases every year. The way we respond now will shape the lives of millions of Nigerians in the years ahead. So, as I said, joining me is Dr. Wamaka Lashibikon, a highly respected clinical oncologist and the president the Association for Radiation and Clinical Oncologists of Nigeria. She has dedicated her career to strengthening our oncology workforce and expanding access to treatment and championing research-led solutions, and also championing the cause of cancer patients across Nigeria. So, Doki, thank you very much for joining us and welcome back on Kakaki Cancer Awareness. So,
Thank you. Thank you for having me.
so what's our topic today? Is the future of cancer treatment in Nigeria. First, together we fight, together we win. Sit back, relax, and let's get these questions going. Doc, let's start with the big picture. As president of ACON is the Association for Radiation and Clinical Oncology of Nigeria. Has would have As president of ACON, how would you describe the current state of cancer treatment in Nigeria, and what is your vision for its future?
Well, first of all, I'd like to say that cancer treatment in Nigeria is not where it used to be. There has been some progress that has been made. And first of all, I'd like to just briefly touch on a few areas that define treatment. Now, I'd like to start taking it back a little bit from diagnosis, because really you cannot form an accurate evidence-based treatment plan if you don't have accurate and timely diagnosis. Now, in that area, Nigeria has advanced in some of the techniques and the technologies and the capacity that is required to have that kind of detailed histopathology results for diagnosis. Example, lung cancer. Recently, we've now been able to type the different types of lung cancers we see, and that helps with treatment decisions where you can now have targeted therapies to lung cancer, and depending on the type. And then, of course, breast cancer, which is the commonest cancer we see here in Nigeria, has also received a boost in terms of diagnosis. We know that this test, the test to type it, to determine the type that will allow oncologists to treat appropriately, access has been expanded recently under the NCAP program. We have more government-owned sites that are able to offer this testing to people and at a reduced cost. So there has been progress in that area as many other centers are opening. There have been attempts at quality improvement, quality control with the testing, but obviously a lot more needs to be done. Same also is with the other aspect of diagnosis, which is imaging. And we now have at least available in the country, but I must say the costs are still prohibitive, some aspects of nuclear medicine that help to also define the exact area and location of the cancers so that, again, to allow better treatment options for patients. Then I would say that as we move from diagnosis to treatment in itself, where we know that the main forms of treatment are radiotherapy, systemic treatment, and surgery. I think Nigeria has made the greatest strides in providing access to radiotherapy. In the last maybe 5, 6 years, we probably had only 2 or 3 centers at best offering radiotherapy. Now we have as much as 12 sites across the country with representation in each geopolitical zone, having the high-end linear accelerators in these countries. I know that last month, 3 new machines were commissioned with an additional 2 centers. So that brings the number of facilities that people are able to access in Nigeria to about 16, 17, and sector as well, which makes it a little bit more dynamic, increased. There's attempts and coalition by the federal government to support capacity development for surgical oncology, and then even all the other areas, all the other subspecialties that are required for treating cancer patients. So when we look at that spectrum, there has been improvement. But I like to say that it seems like it's a patchwork where you have pockets of excellence in these sites where I mentioned, but then surrounded by wide areas of geographic disparities where people don't have access to the basics, let alone the highly advanced technologies that we said and resource-driven approach to improving and scaling of these resources and facilities where they're across the country so that more people are able to access this service and, of course, affordable manner. So in a nutshell, we have made progress, but a lot more needs to be done.
Thank you. Yes, I would agree with you. A lot has been done. Yeah, but there is still a lot that needs to be done. Yes, I agree with you. Okay, so in which case, what would you say? Because if you look at one of the persistent challenges, as we all know, is late diagnosis. So what concrete steps can be taken for early detection? I think to an extent you looked at it, but what I was looking for would be things about early detection and public awareness.
Yeah, I think just to go back a little bit, Nigeria, we need to really look at the root cause analysis level amongst our population. And so they don't know there's a low level of health literacy, and there's no practice for early detection screening programs. And then coupled with the fact that treatment on the other side is expensive. So I'd say that's too late presentation of cancer in Nigeria. We need to talk about it a lot more, improve awareness, not at the cities, but even down to the grassroots. The community health workers need to be involved. The gatekeepers at the communities, the traditional leaders, the religious leaders, all of these people need to be, that it is not a death sentence. And it is heavily stigmatized. So these are the things that can prevent people from actually presenting late because they don't see they don't see light at the end of the tunnel. So I think that with providing more awareness, let's socialize it, let's talk about it as much as possible. I mean, we did it with COVID when during the COVID pandemic, it was all over the place, even in the grassroots People knew what it was. People had some understanding of the symptoms of. Hello?
Yeah, we can
Did
hear
you hear
you.
me?
Yeah, yeah. Your
Okay.
network is really fluctuating. Is it raining where you are?
Yes. This is the rainy season. So basically, to recap, what I was saying is that talking about it more, increasing awareness is definitely one way to go about it, as well as providing funds to be able to, so that people with the diagnosis can actually seek treatment and get to the end of their treatment, and ultimately, for those that present early, have better outcomes, which again reinforces the belief that it is not a death sentence.
Okay. Okay. Let's go. I'm going to ask you a question. And ACON is we're about to have the ACON National Conference, yeah, which is coming up, I think, in Port Harcourt in the next 1 month or so. And it focuses on bringing together voices, leading voices on oncology. Okay. So, what key outcomes or initiatives do you hope will emerge from this gathering to shape the future of cancer treatment in Nigeria? And when I'm talking, I'm looking at, we do know that a lot of new technologies are coming. Start looking at how do I call it? I always use the wrong word, but the one that has to do with sequencing. That will make sense to you. So how do they work?
Okay, so
I'm not a
yes,
medical doctor. I don't take credit for what is not mine. I know you know what I mean.
yes. Well, you're doing very well, learning some of the language and working with us to help us deliver better services to people with cancer. So thank you very much for your efforts. So like you said, the conference is in Port Harcourt. It's next month, and the theme is innovation through collaboration, because we need a collaborative approach to be able to solve the cancer problems that we have in the country, to make great strides and inroads to reducing the mortality and the morbidity rates. That's the burden of cancer that we have in Nigeria. So the conference is going to explore collaborations that have worked, collaborations that have based on innovation, and innovation not necessarily high-tech, but the things that we do within our local context that makes a difference and that yields positive results. In addition to that, we're also going to be looking at technology, the role of artificial intelligence in oncology. Like you rightly said, technology is key. In this era where technology holds promises in driving many areas, we cannot put our heads in the sand like ostriches when it comes to healthcare. We need to understand the opportunities that exist, but also be mindful about the hazards with data breaches and looking at proper governance that surrounds the use of AI and technology in improving cancer outcomes in Nigeria. We're also going to be looking at other issues pertaining to looking at the whole oncology business, oncology as an enterprise, looking at all the aspects of oncology in terms of research, capacity development, private sector involvement, how the government plays a role, and what we can all do synergistically to improve cancer outcomes in the country. This year, we're doing something a bit different. We have put out a call there where we are asking the bright minds in the country, the undergraduates, the postgraduate students that are in STEM, to bring in their A game, to help us, to direct us, on which, around ACON's 4 strategic pillars, on what we need to be doing, what we need to be focusing on. So that call is out there. We received a lot of essays, and the deadline is on Friday. So again, it's still open to more people coming in, and we hope to receive more essays that really drive innovation, that break the stereotypes, that will help us to think about innovative solutions, disruptive ideas that will move the needle forward in improving cancer care in Nigeria. During that meeting as well, we have, as ACON, invested heavily in showing the officially licensed Best of ASCO series. So ASCO is an international conference where lots of scientists across the world come together and share ideas and best practices. Of course, because it's in the US and we know what the economics of going to have to attend this conference is physically is in Nigeria as of today, we were able to purchase the license to come and share some of those abstracts, those innovations with our people to help us to get thinking, to think about innovations and adapt some of the abstracts that we'll be reviewing to see how, again, we can improve access, improve care, improve survivorship, improve the capacity building across all the cadres in our community as well. So that is another strong highlight that we're going to be focusing on during the conference. So at the end of the day, at the end of the conference, we hope to have input from policymakers, leaders in the industry, the private sector, the researchers, the clinicians, even the patients and the patient advocates. All of us are going to be talking together, looking at how we can innovate and collaborate together along the 4 basic prongs that holds Akon's pillars, which is capacity development, research, health promotion, and advocacy. So at the end of the day, we will come up with strategic points and directions, which we will share again with the government. We have NICRAT, which is the implementing agency for the government on cancer-related issues. We will share that, we will disseminate widely to the Ministry of Health, and also, more importantly, to the practitioners and the end users, so that we can collectively think about ways to improve the cancer outcome here in Nigeria.
Thank you very much for joining me today, Dr. Lashibikan. It's very nice to hear your voice, and actually I'm looking forward to the Akon conference. So those of you who are out there that want to go, it's in Port Harcourt this year. Doc, thank you for sharing your...
Can I just also say that during that conference, because Akon usually provides seed grants to early career researchers, so we'll be unveiling the cohort 3 of the recipients of the seed grants that will be given out, and we'll also be unveiling the first batch of GI medical oncology fellows, which we are collaborating with an international institution, again, to really drive capacity development for cancer care in Nigeria.
All right, thank you. I don't know.
Thank you.
I'm not going to be there, but yeah, thank you. I really do. So for those of you who don't know, I am actually one of their recipient grant holders. So I am dancing about it. Thank you for that, as the fact that I was a patient grant winner. So let's go. What's clear is that while the road ahead has its challenges, the future of cancer treatment in Nigeria can be brighter if we act together. We can agree with that. Yeah. So to our viewers, remember, early detection saves lives. Get screened, stay informed, and be part of the fight in your community. You can continue this conversation online on the Common Cancer Foundation website, and you will find all other details, our Facebook, Instagram, and subscribe. Make sure you subscribe to our YouTube channel, Common Cancer Foundation, NIG 281. There you'll get a lot of information about what's going on. To Dr. Maka, I want to say a very big thank you to you for joining us, and to all our viewers, thank you for being with us. We look forward to seeing you again in 2 weeks. Have a lovely day.
Thank you.
Thank you, Doc. Have
Bye.
a lovely day.
Bye-bye.
Bye.
And to you, the host, we say thank you very much for always bringing all this information out here for the public. Great job you're doing there. Do have a great day as well.
Yeah, thank you, Dr. Denise. Have a great day.
Bye. You too, guys.
Yeah,
Enjoy.
Our message is very clear. Together we'll fight. Together we win.